Back in the chair is Rob McConnell from the X Zone. Your last visit, we were talking, or one of your last visits, we were talking about suppressed technology, specifically regarding the 200 mile per gallon carburetor.
That's right.
And we had details on that. And there was just, during the course of that interview, there was a cursory mention of some suppressed research in the medical industry or field, and that just brought on a flurry of calls. And so that brings us to our next segment here on CH Morning Live. There's so much out there and so much misinformation. We're going to try and wade through as much as we can, particularly with alternative treatments. The medical establishment is always at loggerheads with alternative medicines, often for very good reason. But there are also conflicts of interest in terms of pharmaceutical companies and research dollars. And first up, ESIAC.
ESIAC. ESIAC was brought to the forefront by Irene Case. She's called the nurse of cancer. Once again, this is going back into herbology. Herbology goes way back when, in fact, we can even bring alternative medicine and New Age medicine that is creeping up very fast and making a considerable indent in the scientific medical field, all the way to the Egyptians, where they believed in color therapy, they believed in music, they believed that if you take the natural elements and apply it to a natural disease, it'll cure. Then we go to Greek mythology and Greeks who hypocrisy actually said, well, wait a minute, let's take a good look at this alternative so-called medicine as it relates to what he was trying to set up. And then we go into Sir Isaac Newton, who was into looking at curing the body through light. And then we come into today's plethora of all the medicine or alternative medicine, miracle cures that are out there on the internet. And Bob, I've got to tell you, when you're surfing the net, when you're going through any health magazine, no matter what it is, go with caution, go with ease. But in all cases, remember, the most important medicine out there is the power of positive thought.
Yes, and of course there's a lot of research on that as well,
there is,
and the correlation is a little evasive or elusive. But I want to bring it back to this ESIAC cream. In fact, there's some staff members that their parents are on it. And, I mean, the word of mouth on this is quite remarkable. She was a Bracebridge nurse who, she spent her life treating cancer patients. When she presented it to various medical societies, doctors are so impressed, they went to Parliament to actually get a bill through to allow her, or I should say, to actually allow her to practice and get her a license.
Well, we've got to, you know, like she brought it to the forefront, but it actually goes back to the members of the First Nations who knew well beyond our comprehension that herbs, natural medicine is the greatest healer. I was speaking to somebody in the medical community, and they said, Rob, it's very simple. Whatever is natural, cure with natural. Whatever is man-made, cure with pharmaceuticals.
Right, we should mention with ESIAC cream or whatever form it comes in, this is actually more in terms of pain management.
That's right.
And apparently its benefits are in terms of with radiation, chemotherapy, and it has seen results there, although, again, the scientific community has not really come to a conclusion on this.
Of course not, because, you know, we're actually, what we're doing is we're telling the scientific community, hey, for all these years you've been telling us this, that, and the other thing works, and now we're finding out that the herbs that were known way back when are actually working. So what's the problem here? I also have to caution the viewers that when they're going into anything that is off mainstream, it's always good to work with a doctor. Work with your family doctor on these things. Just don't take it on your own. If you're on some type of medicine, don't stop it, whatever you do. But follow the prescribed methods until you can actually see the difference yourself.
At least at the minimum, I mean, most of these, if they do not work, at least they're placebo. I mean,
well, yes and no.
Are there some dangers there?
Yes, there are, because what happens if you're taking something that will actually work against whatever the actual problem is that you're having? This is why, even though, Bob, I'm a strong believer in alternative medicine and naturopathic medicine, I also believe that the medical community does play a very important part in health.
Now, this brings us to the conflict of interest, too, you know, in the battle between the pharmaceuticals and the alternative medicine industry. And, of course, we have cases, the famous one with Apotex and Nancy Olivieri, she's a blood specialist with Toronto Sick Kids, where she decided to change her mind on a report in a specific drug. They had research dollars involved with it. They threatened a legal suit. So there's a huge conflict of interest in terms of research, in terms of alternative medicines, and where R&D dollars are going.
Well, let's go further than that. Let's go to the 1800s, where you had Dr. Finson, who, using infrared light therapy, was able to cure lupus.
Yeah, we have some pictures here. We quickly have to go to break, but I just want to show some shots on this, rather. These infrared machines now, what kind of benefits or what kind of clinical results are we seeing?
Clinical results, we're looking at Nobel Prize-winning technology. Going back to 1903, Dr. Finson's infrared light therapy actually cured lupus. And here we have the technology that was used up until the 1960s in hospitals, but then it was a matter of dollars and cents. Would you rather have a nurse sit with a patient and use the infrared, or would you rather pop a pill that'll take care of the effects?
Pain management's a huge industry.
Oh, it is, and you know, it's a real part of life.
Not to say that there's any, we're certainly not suggesting that there's any conspiracy here, but I guess it's the will in terms of R&D dollars and where dollars are spent. Yeah.
Big money.
Huge subject. If you want to find out more, let's throw some numbers up on screen and a website too, xzone-radio.ca. And of course, Rob's phone number is 905.com, I should say, 905-354-6677. Thanks, Rob.
Nice talking to you.
All right, see you in the next X Zone. We'll see you on the last half hour of CH Morning Live. We're back in 2 minutes.